The doctor's panel streamlines clinical operations by standardizing patient data and clinical functions, allowing healthcare professionals to deliver efficient and informed patient care. To access the doctor's panel, navigate to the clinical module and select Doctor. First, ensure that you're signed into your room, as shown here. When a patient is queued in consultation room, the patient record will be available in doctor's mini queue list. The mini queue indicates the patient ticket number, OPD number, the name of the patient, the room the patient is coming from, and the time they have spent on the queue. Select the patient by clicking on the name once. The patient's demographics will be displayed in the patient's details section. You can also call the patient by double-clicking on the patient's name. The vitals captured from the triage will appear on the doctor panel section. Clerk the patient details on the provided fields. After filling each field, ensure you press the blue plus button to save. Enter patient's complaint. This section allows the doctor to capture the patient's subjective description of symptoms, discomfort, or condition. Click on the Add button to save each complaint. Enter history of presenting illness. This is a detailed narrative about the progression of the patient's current condition or illness, including onset, duration, severity, and any associated factors. Enter the medical history. Here, the doctor enters details about the patient's past medical conditions, chronic illnesses, hospitalizations, or any other significant health issues. This helps in understanding the patient's overall health. Enter the surgical history. This records any previous surgeries or procedures the patient has undergone. This is crucial for avoiding complications with current treatments or prescriptions. Enter the family history. This section collects information about any hereditary or genetic conditions in the patient's family. It's essential for understanding potential risk factors for diseases such as diabetes, heart disease, or cancer. Enter social history. This involves gathering information about the patient's lifestyle, including smoking, alcohol use, occupation, and exercise habits, which may influence their health. Enter the economic history. This section may capture information about the patient's socioeconomic background, including employment status, insurance coverage, and financial capacity for healthcare, which can affect treatment options. Record any known allergies the patient has, especially to medications, food, or environmental factors. This is critical to avoid any adverse reactions during treatment. Enter your impression. This allows the doctor to note initial clinical impressions based on the patient's symptoms, examination, and history. It could also include working diagnoses. You can have more than one impression. Ensure to click on the Add button to save. Enter the diagnosis in this section. The doctor enters the final diagnosis, and they may select from a list of ICD-10 codes, International Classification of Diseases, for accurate and standard documentation. You can add more than one diagnosis. Ensure to click on the Add button to save. The clinical summary is a comprehensive summary of the patient's consultation, combining all gathered information. Input the summary and click on the Save button. Below the panel, there is the patient's previous visits section that shows the report of the patient's previous visits. Once done recording required details, click on the Actions button. Click on Queue Patient, then Queue Patient to Next Room.